Do you frequently feel like your nose is always running, especially when you're near flowers, dust, or pets? Or maybe your eyes get watery and itchy every spring. If yes, you might be dealing with allergic rhinitis, also known as hay fever type I. It's not a cold, it's your body overreacting to harmless things like pollen or dust. Think of it like your immune system sounding a false alarm. For example, when someone smells fresh grass and starts sneezing nonstop, that's often hay fever at work. It's very common and affects millions worldwide, especially during certain seasons. What exactly causes hay fever? It happens when your body mistakes harmless things as dangerous invaders. These triggers are called allergens. Common ones include pollen from trees, grass, or weeds, especially in spring and fall, dust mites in bedding or carpets, pet dander, tiny skin flakes from cats or dogs, and even mold spores in damp places. Let's say you're cleaning your attic and suddenly start sneezing. The dust and mold up there might be the culprits. Your immune system releases chemicals like histamine to fight these invaders, which causes all the annoying symptoms. How do you know if it's hay fever and not just a cold? You'll notice signs like constant sneezing, a runny or stuffy nose, itchy eyes, nose or throat, and watery eyes. Unlike a cold, it doesn't cause fever. For example, if every morning when you wake up you sneeze 5 to 10 times and your nose is blocked, but you feel fine by afternoon, it could be linked to dust mites in your pillow. Another clue, the symptoms happen at the same time each year, like every spring, or in specific places, like your friend's house with cats. Kids might even have a nasal salute, rubbing their nose upward with the palm, like a hand wave. How do doctors know it's hay fever? They ask about your symptoms and when they happen. For example, do your eyes itch when you mow the lawn? Then, they might suggest skin prick tests, where small drops of allergens are placed on your skin with tiny pricks. If you're allergic, the spot will get red and puffy, like a mosquito bite. Blood tests can also check for allergy-related antibodies. Treatment: avoid triggers first. Medicines like antihistamines, for example cetirizine, block histamine and reduce sneezing and itching. Nasal sprays with steroids reduce swelling. For long-term help, allergy shots, also called immunotherapy, slowly train your body to stop overreacting. Imagine getting a shot every week for a year. Eventually, you might not sneeze around cats anymore. Can you stop hay fever before it starts? Yes, prevention is powerful. Keep windows closed during high pollen times, like early morning in spring. Use air purifiers at home. Wash your pillowcases weekly in hot water to kill dust mites. If you're allergic to pets, keep them out of your bedroom. Wear sunglasses outside to block pollen from eyes. Think of it like sunscreen. It's easier to prevent the problem than to fix it later. For example, after playing outside, change clothes and shower to wash off pollen. Simple habits make a big difference. Scientists are always looking for better ways to treat allergies. One exciting area is allergy vaccines, not shots, but tablets or drops under the tongue, sublingual immunotherapy that you can take at home. For example, there are now dissolvable tablets for grass or ragweed allergies. Researchers are also studying how gut bacteria affect allergies. Could yogurt or probiotics help? Other studies use AI to predict pollen levels by location, so your phone can warn, high pollen today, stay indoors. These advances aim to make life easier for allergy sufferers with fewer side effects and more personal